Did you know that approximately 1 in 20 people struggle with skin picking or hair pulling disorders, known as Dermatillomania and Trichotillomania? These behaviors are more common than many realize, often affecting a person's mental health and quality of life. But what's actually going on here? Body-focused repetitive behaviors, or BFRBs, are a group of habits that can be really frustrating and even debilitating for some people. They include things like skin picking, hair pulling, nail biting, and even excessive exercise or tanning. These habits might seem like minor quirks, but for many they impact mental health. Skin picking or hair pulling can be really tough. There's the emotional toil, the feelings of guilt, shame, and anxiety that come with these habits, which can be overwhelming. Many people feel like they're trapped in a cycle of behavior that they can't escape. And then there are the physical consequences like scarring, the hair loss, the skin infections. It's not uncommon for people with these habits to feel like they're hiding behind makeup or hats just to cover up the physical signs of what they're doing. But it's not just the emotional and physical consequences that make skin picking and hair pulling so challenging. It's also the secrecy and isolation that often comes with these habits. People might feel like they're the only ones struggling with these behaviors, and that can be a really lonely place to be. They might avoid social situations or feel like they need to hide their behaviors from friends and family. And of course, there's a shame and stigma that can come with BFRBs. People might feel like they're somehow flawed or broken because of their habits. On top of all that, there's the myth that people with BFRBs are just somehow flawed or lacking in self-control. But the truth is, these habits are often a symptom of deeper psychological issues. They might be a way of coping with overwhelming emotions or a way of trying to exert control over a chaotic world. So until we address those underlying issues, it's unlikely that the habit will change. But what even drives these habits? For many people, it's anxiety, stress, and/or trauma. When we're feeling overwhelmed or uncertain, our brains might try to find ways to cope, and that can manifest as a behavior, like skin picking or hair pulling. It might be a way of trying to release tension or distract ourselves from our worries. Other people might develop these habits as a way of trying to perfect themselves or achieve some kind of ideal. Research has shown that people with BFRBs often have higher than average rates of perfectionism, and that can be a really tough trap to get out of. Research has also shown that these people with BFRBs often have differences in brain structure and function, particularly in areas related to impulse control and emotional regulation. That doesn't mean that people with BFRBs are somehow broken, but it does mean that they might need to work a little harder to develop strategies for managing their emotions and behaviors. And it's not just about individual differences. Environmental factors like trauma, stress, and social pressure can all play a role in the development of BFRBs. So what can we do to manage these habits? First, we must understand that BFRBs are not something to be ashamed of. They're a sign that we need to take care of ourselves and find healthier ways of coping. One strategy is to practice mindfulness and self-compassion, to acknowledge our feelings and thoughts rather than trying to suppress them. Another approach is to find healthy alternatives to skin picking or hair pulling, like meditation, exercise, or creative pursuits. Cognitive behavioral therapy, or CBT, can also be a really effective way of addressing the underlying causes of BFRBs. By identifying and challenging our negative thought patterns, we can start to break the cycle of behavior and develop more constructive habits. And of course, there are also medications and therapy groups that can provide support and guidance. The key is to find what works for us and stick with it, because overcoming BFRBs takes time, patience, and practice. In conclusion, skin picking and hair pulling are complex issues that require compassion, understanding, and support. By acknowledging the emotional and physical consequences of these habits and exploring the psychological triggers and underlying causes, we can start to develop more effective coping strategies. Thanks for watching. If you struggled with BFRBs, I'd love to hear about your experiences in the comments. And if you're looking for more videos on mental health, do subscribe and be sure to check out our channel for more.